Welcome to the Pickleball Recovery Podcast, where we highlight products and practices to help you feel better faster, so you can spend less time stiff, sore, and injured, and more time on the court doing what you love. This podcast is sponsored by AlloMD. Don't just mask pain, eliminate it. AlloMD provides intense relief and advances continual repair for both acute injuries and chronic pain. All-natural, patented technology developed by doctors to get you back in the game fast without the use of opioids, steroids, or NSAIDs. AlloMD, harnessing the power of pure natural ingredients that provide deep, penetrating repair. Patented, validated, natural. Learn more at www.allomd.com and make sure to use the discount code PBR at checkout to save $5 off your order. What's up? Hey, it's your host, Tim Ringgold. Welcome to Pickleball Recovery. I'm glad you made it here. If you are listening over on, one of our podcast platforms, whether it's Spotify or Apple or, where else are we? We're on Audible, Google Play. Thanks for listening to us over there. And if you are on YouTube, enjoy. And if you're not on YouTube watching the video of this, you got to go watch the video of this because the setup for this particular interview is just awesome. It's just super fun. And I want to thank everybody who has rated and reviewed the podcast over on the podcast platforms. You guys have done a really amazing job, and it really helps the algorithm to push it out to more people who listen to podcasts and like pickleball. If you haven't yet, if you would be so kind to go to YouTube and subscribe to the channel. We need subscribers, not going to lie, just going to be honest, because the more subscribers, the more that YouTube will suggest the videos to other YouTube users that watch pickleball videos. And of course, we want to get them this content because, of course, there's a million different things on technique and on equipment, but there's not a lot on how we take care of our body. And our body is our most expensive piece of equipment. So let's help people play more, right? Feel better faster. That's the whole mission of this pod. So if you would please to subscribe to that. And then the last thing is, just share the podcast or the YouTube channel with a buddy or a friend or your partner. In the pickleball space, we all refer stuff to each other all the time. And so if you would just include this in that conversation, I would be so grateful. And if you've done that already, thank you. I know some people have, because one of my buddies has tennis elbow, and he said to me at a tournament, he's like, dude, you don't even know how many people have sent me the link to your episode on tennis elbow. It was like he was almost annoyed by it. And I was just like, yes, that's the whole point of this, right? Is that we just want to refer resources, again, because our body is the most expensive piece of equipment we've got. Cool. All right. So thank you for all of that. Let's move into the interview. There are just great people in this pickleball space, right? It's a great community. And I want to introduce you to one more great person. His name is Dr. Greg Song from Air Relax Compression Therapy. I met Dr. Greg at Tyson's camp, Tyson McGuffin pickleball camps. Shout out to those. You should go. They're phenomenal. I totally up-leveled when I went. I met Dr. Greg there. And then you will see Dr. Greg on the APP tour stops, where he has Dr. Greg's recovery zone. Or recovery lounge, and you can come experience the boots and the shorts for yourself. We're going to talk about why they work, how they work. You're going to hear my story. It's pretty profound, like the difference they've made for me. I stand behind them 100%. If you want to learn more about them, go to www.getairrelax.com. If you decide to jump in to a pair of boots or whatever, use the discount code PBR10. You'll save 10% off the website pricing. There you go. So let's jump in, sit back, relax, enjoy the ride, and I'll see you on the other side. Dr. Greg Song, welcome to Pickleball Recovery.
Tim Ringgold. Great to see you, brother.
Great to see you again as well. This took some work.
Hey,
this involved
if they only knew.
Yeah, I'm trying to think have I had an interview since the dog bite. So for those of you who don't know, Dr. Greg lives in Surprise, Arizona. I live in Southern California. I was coming out to Arizona 2 weeks ago.
2 weeks ago.
2 weeks ago, we were going to shoot this interview in the comfort of your own home. And while I was at the truck stop, I got bit. I don't want to use the word attacked because that's kind of like a little dramatic. But I got bit hard by a dog that's their shots weren't up to date. They were overly aggressive. They were from a town just minutes from the border, and it was a female being that aggressive. And a friend of mine's an expert in rabies, and they were like, "Sorry, red flag, red flag. You got to go straight to the emergency room." So lunch had already been ordered, and yet
That's
you had,
our.
you had to
That
eat a lot of pho that day, didn't you?
we ate a lot of pho that day.
Yeah, so it didn't happen. But luckily, here we are. You were planning on being here in SoCal, just a few, like this is less than an hour from my house. So we were able to redo this pretty quickly. And here we are.
It was meant to be.
Meant to be. So now you know. Here's the thing is, the dog's name was Logan, and it was a female. So my theory is, much like Johnny Cash's Boy Named Sue, he's a very aggressive man in the song A Boy Named Sue. And my theory is that poor Logan is a very aggressive female because she feels in her heart she should never have been named Logan. And that's my theory, and I'm sticking to it.
I agree. We need some psychological. We need Caesar Milano. Yep. We need intervention.
We need an intervention.
We need an intervention.
Drag him out from LA or wherever he is, bring him out to the desert, sit down. They're in Las Cruces, New Mexico. That's where the family is. So it's like far. But yeah, anyhow, I digress as usual. Here we are. We are at the APP SoCal Classic, and we are in the Dr. Greg's Recovery Lounge, which is where we met. We met in the Recovery Lounge in La Quinta.
La Quinta.
At the PPA Masters. And I had played singles that day. It was a Thursday. And I met you, and I told you about my podcast, which at the time was really an idea. I knew I was going to do it. And I was like, I had envisioned this very thing, a space where people could come to recharge, recover, because these days are grueling, you know. And we hit it off immediately, and you put me in these amazing compression boots. And what happened was the next morning I had a training session at 7 a.m. because Saturday I was coming back to La Quinta for doubles. Now, typically for me, when I play singles or doubles, the next day I wake up, I am stiff and I'm sore, just the way it is. That morning I woke up and it was like I had had like a 3-day rest. And I had never had that experience the day after, particularly playing in a tournament. And so I was like, this stuff works. Let's talk more. And I went home a happy customer that Saturday, and I have been using these pretty much every single day. A paddle is in my hand before I go to bed that night. This product is on my body. So just want to say thank you for setting up shop in La Quinta, because this has been a game changer for me as I've played a lot of tournaments in 2022 already. And part of the reason I can is because of the way these speed up my recovery time. So how did you come to discover, like that's how I met you. How did you meet compression?
6 years ago, Tim, I finally had my knees replaced. And at the physical therapy center, after a grueling session of rehab,
Yep.
they put me in these compression sleeves.
Okay.
Now, albeit it wasn't this brand that I'm representing now,
Right.
it was the more expensive brand,
Okay.
which obviously I had no idea there was a difference. But it felt so incredibly healing after the session. I said, oh my gosh, I got to get a pair of these.
Really?
So
So what was it like because you did both your knees at the same time.
Correct.
Because you're crazy. So, but you're also very logical, which was you were like, I only want to go through this hospital experience once.
Exactly.
So that was quite genius. It's like having twins. You know, you get 2 kids, 1 pregnancy.
Yay,
So,
we're finished.
Yeah, yay, we're done. You had twin knee replacements. What was your PT regimen like, and what was the daily feeling like for you? How, and then what happened? You got in these, and then tell me the difference.
After the very first time that I had the session, this light, even in my thick head, resonated. It's like, get this, use this at home. Asked the PT, says, yes, it would really help.
Okay.
did my research, did my due diligence, called the company, which we won't name, but they were very expensive. They wanted $1,500.
Okay.
So I said, oh, well, let me do some more research. I found this company, Air Relax, got them at a third of the cost.
That's a big
Found it,
difference.
huge difference.
Wow.
Found out that the pressure was 2 times more than the one they were using at the PT office.
Okay.
And I just took off. I was using this, believe it or not, 6 to 8 hours a day. I had double knee replacement. I wasn't going anywhere.
You're not going anywhere.
not going
anytime
anywhere.
Soon.
And the normal rehab period for double knee replacements is 6 months.
Yep.
I cut it in half by 3 months.
Really?
I was back at work as a chiropractor in 3 months.
Really?
Albeit I wasn't 100%,
Right?
but at least I was walking,
Yeah.
standing, and moving.
Totally.
So it changed my whole life.
Yeah.
As far as, being in practice, I never referred anything to any patient unless I used it first.
Yep.
Because I want to make sure, hey, it worked for me.
Yep.
I can, with a clear conscience, tell you, hey, it worked for me.
Yep.
Might work for you.
Yep.
So push the tape further. I had an opportunity to become a distributor. Lived in Surprise, Arizona. A lot of people play pickleball there.
Yep.
They said, hey, Dr. Greg, you need to go introduce the pickleball world.
Okay.
So
when's this?
this is 2019 in November.
Okay.
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 Our very first tournament was a Tommy Wong. They had us on the grass. We're the new kids on the block. Everyone thought we were selling chairs.
These?
Yes.
So great. I really like those recliners. Where can I get those?
I tell my wife, Andrea, I go, if I had any hair left, I'd be pulling it out. Here's the cool thing. We did about 4 tournaments in a row.
Okay.
And by the 4th tournament, we started gaining traction.
Got it.
And we also have the lovely blessings that several high-profile pickleball players were buying our equipment.
Got it.
So that was kind of like our baptism and acceptance.
Yes.
2020 comes. We're like, yay, we're going to go kill it. March.
Right. What else comes in March of 2020?
Everyone knows.
Oh my gosh.
So we lost that whole year.
Yeah. Yeah. No events.
No events.
No events.
So
Did you still have your chiropractic practice at that time?
I was working on and off
Okay.
with a good friend of mine.
Yep.
That we used to practice in Maui together.
Nice.
He was in California, so I was helping him with his office.
Okay.
And, still doing what I do.
Yep.
Yeah. But I really wanted to do this
Yes.
because there's such a great satisfaction because I know how effective this is going to help people.
Totally.
And
I am so impressed by the rehab time. I used to work in PT, in particularly total hips and total knees. My job in the hospital was the young kid who got that patient out of the hospital bed for the very first time, or to put the CPM, that continuous passive motion machine, on that knee.
Continuous range of motion.
Yeah, to the day after surgery. And so I remember very much what it was like for patients going through total knees and total hips, but particularly total knees because I had knee issues at the time as an athlete. I didn't have hip issues, so the hip was like, just kind of like a different part of the body. But I had a particular kind of resonance, with knee injuries, and total knees are. If anyone's ever wanted to be just traumatized, go YouTube a total knee surgery and watch what they do to the human body to get that thing out and in. It's just like they might as well be mechanics in a shop. Just rack, 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 rack. You're like, that's a human body you're doing that to. I mean, the trauma to the human body that a total knee is. So to be able to cut that time in half, and the amount of time is months, that's like not just statistically significant. I mean, that's a major change because of the grueling nature of that rehab.
Yeah.
So, I mean, talk about baptism by fire. Like, you're like, listen, if I could do that with this injury or surgery, it's not an injury, but, imagine what, for anybody else who's, in some subacute level of that, what it's going to do for them.
Totally agree.
Yeah, that makes sense to me.
Yeah. And it's been such a great environment, as you know. pickleball, everyone we meet has been absolutely lovely.
Yep.
I can't explain anymore.
Oh.
You know,
Yeah.
I told Ken at this
There's Ken Herman right there, right off
at
camera.
this tournament, I just said I just love the environment.
Yeah.
You
Yeah.
know,
It's great people.
Yeah, I can honestly say everyone that we have met in the community has been wonderful.
Yeah.
So we like doing it.
Yeah. Yes.
You know.
Yep. Yep. So you're just starting out. You're showing up at tournaments. This is like right at the dawn of the APP and the PPA. So you're doing local tournaments. You're doing PPA tournaments. You're doing APP tournaments. You start meeting some of the pros. Tell me a little bit about you, and whether or not you name names is fine, but just kind of like what their experience and what you noticed.
Okay, that's a great question. We started looking at different pros, and the one right off the bat that hit us, and it wasn't necessarily because he was ranked higher, but he was so much into recovery, was Tyson McGuffin.
Bing, bing, bing.
You know, I mean, 90% of what he posts, besides food, which I love,
Yes.
is what he's doing for recovery.
Wait a minute. Hold on. Stop the press. That's where we met first.
Was it?
We met at his camp. You catered dinner.
Yes.
That was
Oh my gosh, you're
March of
right.
2020 in Newport Beach.
Right.
You came to Newport Beach. We ended up at like the Rib Trader or some random restaurant
Right.
in a back room, and you had the
Newport Rib
chairs.
Company.
Newport Rib Company. That's
Oh
it.
my gosh.
That was the first place because it was Tyson, because
Right.
he's really into recovery, and so that's funny. That's where it all
That's
started.
right.
That was he's our nexus point. Thank you, Tyson. Nice work.
Thanks, brother. So, you know, I used to tease him because I'd see him post and he was using another brand.
Right.
And I saw him at a tournament. I said, "Hey, when do you want to get in some really good compression stuff?" He gave me that kind of quizzical look. He says, "What?" So I said, "Well, let me send this to you and you'll see the difference." Well, boom. Our actual product is an FDA cleared medical device.
Yes.
It's also the highest cleared compressor on the market at 4.4 pounds.
Yes.
So unlike it's paddles, all paddles aren't alike.
Right.
All compression systems aren't alike.
Amen.
So one of the things that our strong point in actually sharing this with athletes is the fact that it's FDA cleared, highest compression at 4.4,
Yep.
and we're affordable.
Yes.
So the competitor sleeves are sometimes 2 to 3 times more costly than ours.
Wow.
And you get great customer service because you're dealing with me and my wife, Andrea.
Yeah. Yep.
You have our cell number, not
Yep.
an 800 number.
Nope.
And I can honestly tell you, Tim, in 3.5, 4 years, we've had 0 returns.
Wow. That doesn't surprise me.
Anybody who walks by our booth, it's all positive.
Yeah.
So that makes you feel really good as far as, you know, first off, I know the equipment works.
Yep.
We have a great piece of equipment
Yep.
designed by an aeronautical engineer that I work with.
Wow.
And our goal in life is to have every pickleball player using our equipment.
I love it.
If we get halfway or even 1%, we'll be happy.
That's right. That's exactly right. Given how many people are coming into the sport on a daily basis, it's an ocean of people, and this is why I have the podcast, because it's an ocean of people in pain. You know, that was my first year, was like just pain, and I was like, this sucks because I love this sport so much. I'm not stopping playing, but man, the other 20 hours a day really hurt. I mean, really hurt. You know, I developed plantar fasciitis. I had, muscle tears. Like everybody who listens to the pod has heard the litany of pain I've been through, but I'm just the average person. That's, we all have the same experience. So anything that reliably works to diminish that is just like, bring it in, let's go. And I've heard the same thing from all the other people I know who own these, as they all say the exact same thing. They're just like, these are a game changer. So let's talk a little bit about why. So the problem is, whether it's that day or it's day 2, that delayed onset muscle soreness, or DOMS, where it's talked about in the literature, athletes all know what that is, and they all kind of fear it, And there's something happening in this device that is changing the timeline. of that recovery. So can we kind of break that down a little bit of the science?
No, absolutely.
So we know what's going on under the hood?
Absolutely. Part of our presentation is we explain to them first, we have an FDA cleared medical device.
Yep.
And I share that because there's so many knockoffs on this equipment.
Yeah.
And you want to be careful because the FDA makes you go through a very stringent testing to make sure that what you say it is,
Yep.
so it's accurate.
Yep.
So you're knowing at each level what kind of pressure you're getting. The reason it works is because it's improving our overall circulation. Athletes,
Yep.
when they're working out, they're competing, they're creating a lot of lactic acid buildup in their muscles.
Gotcha.
And it's actually lactic acid that causes soreness in the muscle.
Gotcha.
So one of the things that this actual modality will do is it will force that lactic acid to your normal filtering organ in your body.
Yep.
So the next day, guess what? You don't have the soreness.
Yep.
And because it's sequential, we're actually massaging the muscles. That's why you don't feel as stiff, which basically what you felt when you first used our equipment.
Yep.
And it's what everyone feels when they get in it.
Yep.
Tim, we do 5-minute demos.
Right.
In 5 minutes, when we get people in the sleeves, they get up and they give me that look like, I can't believe this.
Right.
I feel like I can go play again.
Yeah.
And I just share with them, listen, if you do this part of your routine, you're going to stay on the court longer.
Yep.
Your legs are going to be healthier. I mean, that's the perfect storm.
Yeah, absolutely.
So,
Absolutely. I think the real question becomes which room in the house are you going to, is it going to be in your family room with the Barca lounger? Is it going to be in your bedroom? Where will you set up shop? Because you will set up shop. You're going to find a spot.
and this interesting appointment you made, that's always like, okay, where can I can see it in their face. Where am I going to put
Where
this?
am I going to put this?
Because we tell them, leave it out. If you don't
Yep.
leave it out,
Oh, you won't use
you
it.
know,
Yeah.
it's like a toothbrush. If you had it hidden in the medicine cabinet,
Right.
you might not brush your teeth
That's
every day.
right. Out of sight, out of mind, 100%. And they're out. Mine are out all the time, and I apologize to my wife. I'm like, sorry. Like when we win the lotto, I'm going to have a recovery studio where my PEMF mat is, and my red lamp is, and my compression boots are, and I won't have to annoy her anymore with the Frankenstein lab. And I'm going to get a hyperbaric oxygen tank along the way, just for good measure. Those are great, but also take up a lot of space. It's like I'm a guitarist, and there's this thing in guitar as grown-ups get money because they have jobs, right? They buy guitars and they keep buying them until they run out of home, and so it's called guitar acquisition syndrome, or GAS for short. So like how's your husband's case of gas? Oh yeah, it's really bad. It's really bad.
It's in its chronic stages.
That's it. And what they really do is they just run out of closet space, because that's where all the cases have to go. So I noticed we have completed. I've completed my setting. Now the default for this is 15 minutes.
Yes.
Yep. Right. And so I will, like, on an average day, let's talk about how to use these. Like, what's a good kind of for the average Joe and Jane who's going to play socially.
Great question.
Let's talk about how do they use this? What do you recommend?
I actually did a protocol for athletes, but it's really for everybody.
Yep. Do you mind if I help myself? I'm just going to.
No.
Let's.
15 to 30 minutes before an activity, 15 to 30 after an activity.
Okay.
But because this is considered a non-invasive modality in the physical therapy world,
Yep.
you can use it for hours.
Yeah.
You can watch the Super Bowl. You can watch your program.
Like you said, you were using it for hours.
6 to 8 hours a day.
Yeah.
So that's a good. And of course, when I ask people, well, how many days of pickleball do you play? They look at me like, well, of course, every day. What are you asking me that for?
Duh.
So I said, well, use it.
Yeah.
I said, if you use this and commit yourself to using this, you will find that your legs are healthier.
Yep.
You're moving better, and that's where you want to be.
Yeah.
So.
Yeah. Now, because it's an FDA-approved medical device, you can also fly with it. Yes.
Thanks for bringing that up.
Yeah. Kind of a cool. This is different than the other models because
we're FDA cleared. When you get to the gate agent, you say, I have my medical device.
Yep.
They won't ask you what it is because it's against HIPAA. They ask you what condition you're doing.
Interesting. Okay.
So my wife's a flight attendant, as everyone knows.
Okay.
So I made sure she had it cleared, and absolutely true.
Yeah. Okay.
In fact, we had some customers at this event who bought it previously said, "Hey, it worked. I just carried it right through." They said, "Great."
So you can bring it on the plane, and it doesn't count against your like carry-on.
Exactly.
And can you check it and not have to pay to check it, or how does that work?
I'm not sure about that one.
Okay, all right. Super curious.
Yeah.
I haven't flown with it yet. Yet being the operative word. So what I know from right now, because I'm just playing singles this year, I play one event and then I don't need the recovery necessarily, but I know that in 23 I'll be playing multiple events, and so I'll need to be able to go through that kind of overnight rehab, and so it'll be part of my travel gear, at the time. And who knows, if I win that same lottery, I might just have an entourage, like my own little Sherpa. His name's Pete. Hey, Pete, bring the bags.
Hey, listen, I'm available for you any 24/7 there, Tim.
So how many tour events do you try to get to? And
last year, because we lost 2020,
right,
we actually did 8 states and 35 tournaments.
That's a lot of tournaments.
A lot of that, though, was proof of concept of our equipment with the pickleball community.
Gotcha.
And again, not patting ourselves in the back, but we knocked it out of the park.
Yeah, no doubt.
Everybody loves the equipment.
Yep.
We're actually known when we go to an event.
Sure.
And we're just building on that.
Nice.
Now this year we're not doing as many events.
Gotcha. That's a peak. 35 out of 52 is there's only so many weeks in the year. So
we're kind of picking and choosing, cherry picking.
Cherry picking. Yep.
Right now it's 115 degrees in Arizona, so
yeah,
here
oh gee,
Carlsbad,
Encinitas, California in June. Oh, twist my arm.
Yeah, exactly.
Or El Segundo. Once again, you'll be less than a mile from the beach in both.
Exactly. So
both spots.
So we're we want to have fun.
Yeah.
And so we pick nice places to go.
Yep.
See all our pros.
Yep.
Sell some equipment.
Yep.
Have some good dinners.
There you go.
Everyone knows I'm the food guy.
So how do people, let's say they're not at a tournament, because, most pickleballers actually don't play tournaments, right? That's their social players, their rec players. Where do they find you online?
We have our website, getairrelax.com.
Okay. Getairrelax.com. Okay.
All one word.
Okay.
And, or call me direct.
Or just call you.
Yeah.
Okay. What's your number?
It's 949-289-2543. I've had that number since Egypt was built.
I was going to say that's an Orange County, old school Orange County number.
I will not. If it doesn't answer, it's disconnected. It's because I'm not here anymore. God forbid, I'll answer the phone.
That's hilarious. That is awesome. All right. Well, Dr. Greg, thank you so much for joining us on Pickleball Recovery.
Tim, it's a pleasure. You're my guy. We love you.
Oh.
Keep up the great work.
Thanks. Woohoo. Thanks so much for listening. Do you want to know the number one mistake picklers make that leads to increased pain, soreness, stiffness, and injury? Just head over to www.pickleballrecovery.com and download my free guide to playing with less pain and more enjoyment. Listen, pickleball makes us feel young at heart, but not necessarily young in body. So go download my free guide at www.pickleballrecovery.com. See you next time.